Insight's presentation on standards-driven oncology studies, solid tumor, lymphoma, and leukemia. ClinData Insight is a biometrics consulting firm based in the San Francisco Bay Area, specializing in biostatistics, statistical programming, CDISC implementation, big data for life science, and talent solutions. In today's presentation, Kevin Lee will go over standards-driven oncology studies, solid tumor, lymphoma, and leukemia. I'd like to start off by introducing Kevin. Kevin Lee is the Director of Data Science at ClinData Insight. He has helped many organizations to conduct standards-driven oncology studies. Kevin is a well-known expert in oncology CDISC standards and response criteria standards, helping organizations on CDISC implementation for solid tumor, lymphoma, leukemia, and immune therapy oncology studies. He also participated in developing oncology CDISC data models as a CDISC team member and is a frequent oncology speaker at various conferences, presenting more than 10 papers on oncology-specific CDISC implementation. With that, I would like to hand the presentation over to Kevin. Kevin, you should be receiving control of the presentation now.
Okay, thanks, Molly. I'd like to take this time to thank my wonderful colleague, Martin, to prepare this talk for us today. And thank you all for joining our talk today on standard-driven oncology study for solid tumor, lymphoma, and leukemia. So we will start with the introduction of oncology, and then we're going to talk about oncology-specific standards, such as response criteria guidelines and also CDISC standards. And we will show how standard could drive oncology study much more effectively in our studies. So let's talk about the trivia of the cancer. The word cancer is related to Greek word, the crab, because its finger-like projections were similar to the shape of the crab. In year 2010, the economic cost of a disease worldwide was estimated about more than $1 trillion. And 1 in 8 deaths in the world are due to cancer. And cancer is leading cause of death in developed countries. So I'm sure that a lot of us have someone who we know had or have a cancer. It somehow become the common disease nowadays. WHO predicts that new cancer cases will increase from 40 million in year 2012 to about 22 million in year 2030, and also predict that the cancer death will increase from 8.2 million per year to 30 million annually. There are about 30 million cancer survivors worldwide right now, and I like the last statistic. The men and women who are married are less likely to have a cancer, about 35%. So cancer impacts us a lot of different ways. It impacts us personally, financially, and also emotionally. So cure this disease, a lot of pharma companies invest and develop these cancer drugs. So if you look at the annual drug approval in FDA, we notice that there are a lot of cancer drugs developed and approved. In year 2012, about 33% are cancer drugs, and year 2013, about 30%, and year 2014, about 22%, and year 2015 is about 29%. So we notice that there are a lot of cancer studies are done in pharmaceutical industry, and also it is a lot of cancer drugs are developed and approved by FDA. So that means that the programmers and statisticians are heavily involved in oncology studies. Oncology studies are known as very complex and difficult. The reason that it is difficult is that it is quite different from other studies. So let's take a look at how oncology studies are different. So first of all, we need to collect and measure tumors and their response to the drug. We also collect other oncology-specific measurements for response criteria, such as liver and spleen enlargement, bone marrow infiltrate, and blood counts. We also need to collect the oncology diagnostic measurements such as immunophenotype, ECOG, staging. And also we need to consider about toxicity in the lab and also adverse event. And in terms of analysis, oncology study is a little bit different. It introduces a time to event analysis for overall survival, the progression-free survival, time to progression, and object response rate. There are mainly 3 different types of oncology studies: solid tumor, lymphoma, and leukemia. Solid tumor is pretty much the masses of abnormal tissue that grow out of the proportions. Its response guideline is a RECIST 1.1, is the most popular one. And for immunotherapy studies, you follow immune-related RECIST 2009. Lymphoma studies are cancer that start in lymph nodes, and its response criteria guideline is usually CHESM 2007. Leukemia are the cancer that usually begins in bone marrow and usually result in high numbers of abnormal white blood cells. Leukemia has 4 different study types: acute lymphoblastic leukemia, acute myeloid leukemia, chronic lymphocytic leukemia, and chronic myeloid leukemia. So it has 4 different response criteria. And in our presentation, we're going to talk about IWCLL 2008, which is the response criteria guideline for chronic lymphocytic leukemia. CDC also developed and introduced oncology-specific standards. In STTM, TU domain identify tumors, and TR domain to follow and then measure the tumor results, such as whether tumor increase or decrease and how much. And RS domain contain the response for the patient and at given cycles. In ADAM domain, we also introduced time to event analysis dataset. In control terminology, in response criteria, there are complete response, partial response, progress disease, stable disease. In tumor measurements, longest diameters, sum of diameters, longest perpendicular diameters, area, sum of area, tumor state. In response, target response, non-target response, new lesion progressions, overall response, and best response. Now let's go over each study type and its own standards. First, solid tumor studies follow RECIST 1.1, and it has a tumor measurement for target, non-target, and new lesions. If you look at CDC implementations and how response is determined, and sum of diameters and non-target lesions and new lesions are saved in our TR domain. And they're using all 3 assessments, the response will be determined and could be saved in RS domain. If you look at this example, TR domain actually contains target and non-target at given cycles. As you see that the sum of diameters are derived from that each diameters in target. And using this one, you could get a non-target response as a partial response. Obviously, it is that sum of diameter decrease from the baseline. And also non-target response has no changes, and there's no region progressions. So overall response for the patient at this cycle is going to be partial response. In lymphoma study follow CHESM 2007. So it collect tumor measurements in CT and MRI scan. It also collect the lymph nodes nodal masses, actual nodal masses, and it also collects the PET scan on the lesions. It is done there to distinguish between the viable tumors and fibrosis. In additionally, it also collects the bone marrow assessment, spleen liver enlargement assessments. So if you look at how those assessments are implemented in CDISC STTM domain, the tumor measurements in CT scan and PET scan are saved in TR domain, and bone marrow infiltrate going to be saved in LB and FA domain, and spleen liver and enlargement going to be saved in PE domain. And all those assessments will determine the response for the patients at the given cycles. Leukemia study. Now, in our presentation, we will follow chronic lymphocytic leukemia. So its response criteria is IWC 2008. And according to IWC 2008, the study needs to collect the tumor measurement and CT MRI. They also need to collect the lymph node and spleen and liver enlargement assessment and bone marrow assessment. Additionally, the study needs to collect the blood count assessment such as lymphocytes, neutrophils, platelets, and hemoglobin. So if you look at the CDISC implementations on this study, tumor measurement will be saved on TR domain, and bone marrow measurements will be saved on LB and FA domain, and spleen liver enlargement assessment will be saved in PE and FA domains, and blood counts will be saved in LB domain. And using all this assessment, response will be determined for this patient at the given cycle. This time to event analysis in oncology study is also unique from other studies. So using this time to event Adam-Deron model, the statistical programmer could do overall survival analysis using Kaplan-Meier plot or log-rank test or Cox regression model. We have discussed about some oncology specific standards. Let's kind of go over again. In response criteria guideline, we have a RECIST 1.1, CHESN 2007, and IWC-LL 2008. And for the collection, we have a tumor measurement, bone marrow assessment, spleen and liver enlargement assessment, blood count, and response assessment. In CDISC, we have a STTM, ADAM, and control terminology as a standard. For the analysis, we have a overall survival, progression-free survival, time to progression, objective response rate, disease-free survival as a standards. So now using this oncology specific standards, you could develop end-to-end standard-driven oncology studies. Let's take a look at it. In protocol, let's say we decide that we're going to use CHESN 2007. So the collection will be going to be tumor measurement, bone marrow, spleen liver enlargement, and response. And according to that collection, STTM is going to be TR, TU, LB, FA, PE, and RS. And ADAM and analysis is going to be derived from the STTM and ADAMS. So now we see that all those collections from protocol, from collection, STTM, ADAM analysis could be derived in standard, which is we already talked about. So we introduced mainly two standards, response criteria guideline and also CDISC. And we also saw that these oncology specific standards could help to create and develop critical artifacts such as protocol, collection, STTM, ADAM, and analysis based on the standards. So basically, we could build a very effective, efficient, and innovative end-to-end standards-driven oncology study using the standard we have in oncology. Again, thank you for joining our talk today. And then I'm handing it over to Molly.
Thank you, Kevin. Thank you for such an informative presentation. And thank you for viewing this presentation. We will be adding additional videos like this one on our channel. Please subscribe to find out when we will post new videos and to find out other videos in our library. Thank you.
Thank you.